So we are heading down to the hospital right now for the surgery, which is kind of nerve-wracking. I'm with my mom. She's driving me so that we can ride in the carpool, and Jesse is in front of us. If you can see that little vehicle all the way in the front of the carpool, that's her with Lily, so that she can carpool. I have a hospital bag all ready to go. I have like headphones and clothes to change into, so I'm comfortable. Headphones so that I'm entertained at least with music. And yesterday purchased some things to help with recovery, such as like an ointment to keep my lips dry so that they don't, or keep my lips moist so that they don't dry out. And then also like condiment bottles so I can put the food in it so it'd be easier to eat. So I read up on those a couple times and a lot of people said they really like that. So yeah. Oh, and then nasal spray so that my nose doesn't dry out. There's gonna be a lot of blood in my pouring out of my nose, so to use nasal spray just to keep it moist and stuff. So yep, here we go.
Where's your pose? Waiting for Daddy to get out of surgery. Waiting with Grandma. Hi. Oh, and she's learning how to smile.
It's really cool though, because we're actually in like a private family waiting room. It's really nice. There's like 4 couches, and I'm pretty sure those ones pull out to make a bed or something like that. But yeah, it has a TV and a DVD player, but you know, we didn't bring anything like that. But yeah, it's actually really cool. He just went in a couple, let's say about an hour ago, maybe half an hour, 40 minutes, I don't know. It's 2:30, so he went in about an hour ago, and it's about 2.5 hour surgery, so I guess we'll see. So Christian is out of surgery. He's doing really, really well. Thumbs up. He doesn't have that much swelling, which is great. The doctor said that he did amazing and that he should do really, really well in recovery. He's really sleepy now, which is it's kind of, it's very normal. But yeah, so it went really, really well. We're just kind of chilling in his room right now. We'll keep you updated. He has a suction thing for all the lovely blood. Kind of gross, but that's comes along with the territory. But yeah, so he's doing really, really good. He's doing sign language. So this is Christian after his after his surgery. It's what, day 5?
Day 5.
Day 5 of recovery. He's doing really, really well. You know, still quite a bit of pain, and the swelling has gone down. Amazing. His swelling a couple days ago was like literally down to here. Like it was all from here to here. But he does have like stitch marks on both sides from where they had to put the plates in, the screws in. But
And I didn't know I had stitches in my cheeks.
yeah, he didn't know he had stitches in his cheeks, and started playing with his tongue. So that's causing him a lot more discomfort right now. He's on good pain meds, but they're almost up, so we might just have him on ibuprofen, but if that's not working very well, we'll just have to get another prescription. During his surgery, he did really, really well. When he came out of surgery, he threw up 3 times because he had so much blood in his system. That was probably the scariest thing I've ever seen, was someone throwing up pure blood. Even though it wasn't like him bleeding, like from his stomach, it was still like, you know, just blood draining down from the surgery. But it was still really, really scary. And I only saw him throw up once while I was there because I had Lily. So, you know, I had to go home that night. His mom stayed with him overnight. And then my mom watched her while I was able to go and see him after, and then pick him up. So right now we're staying with my parents, which is a major blessing just because they can help out with Lily, and Christian has access to more, you know, bathrooms are closer at night, so he doesn't have to go maneuver the hallways at our house to try to get to the bathroom. And you know, there's lounge chairs and just a lot easier here. But yeah, and he actually got a retainer that goes on the top of his pallet because they had to split his pallet. So he has a retainer in there, and that was no fun to try to figure out how to put back in once he had to take it out to clean it. But
Or scary.
yeah, he actually started freaking out. And I'm like, food intake right now is through these condiment bottles, which actually work really, really good. That's applesauce and peaches and apple juice and not peaches, pears.
Yeah, pears.
Yeah, and then this is how he eats it.
That's fantastic.
As you can see, he actually can talk a little bit. They actually, they did the wiring, or they didn't wire, they banded with elastics right after the surgery, and he actually only had them on for one day, and they took them off. So he's actually able to open his mouth a little bit, which is nice. But nice.
Oh, gassy.
He's very, very gassy. When you're eating pure liquids, I don't know how you're gassy. So we're out here getting our tree for Christmas. There's someone on drugs gonna try to on this Percocet, gonna try to chop down our tree. So pretty. Try to go a little lower. Yeah. Baby wearing Lily. She's fast asleep. As always. Missing out on all the fun. The rest of the family's all back there, picking out their trees too, chopping them down. We're at the Red Barn Tree Farm. You got it, babe.
So we are coming back from the doctor's. I had my second appointment today. Today is day 9. Sorry. He put on elastics, but I only have to wear them at night. I'm just wearing them to get used to it because he put them on, so I need to get used to it. But in general, like, look at my swelling. It's gone down a lot, and I'm able to talk a lot more, and I'm introducing soft foods into my diet, and I'm not having to be on a liquid diet anymore, so everything's going great. Feeling's going good. Maybe on average pain level 1, maybe 2, and every once in a while if I forget to take pain meds, I'll wake up at like a 6. But
It's usually in the middle of the night.
yeah, it is in the middle of the night, so it's not too bad. I mean, last night was a 6, but it wasn't that bad. But everything's going good. I really want the swelling to go down so I can actually see the results and see how it looks. So it'll be a little bit until all the swelling is all gone, but in general, I'm feeling good and it's looking good, and yeah.
Yesterday was my 6-week update from having Lily. He actually didn't even have to check down there. I already started my period, which kind of sucks. But yeah, so unfortunately I had to stop breastfeeding Lily altogether because she wouldn't even latch anymore because she'd get so frustrated that, like, I would be producing milk and stuff like that, but it just wouldn't come out at a good pace at all for her, and so she would get super frustrated, and it would take forever. Like, I would put the breast pump on for half an hour and maybe get 1 ounce, and that's if I hadn't fed her like a feeding before then. So unfortunately I had to stop altogether, which makes me really sad and frustrated, but you know, what can you do? They're actually gonna they actually said I felt like I was being anemic for a little while, and so I'd take more iron, but they just did a blood work yesterday as well, and they said I'm not anemic, so I don't need to be taking that much iron. So they're going to be checking my thyroid levels to see if that could be the root of the problem, because I did a lot of research and they said that some people with thyroid issues, they won't be able to produce as much milk as well, and postpartum depression and all that kind of stuff is kind of tied in with thyroid deficiency. So they're going to check that, so they should have results next week. And I picked a different birth control than the before because the pill would just make me cranky. It was just not fun. I'm thinking about doing the arm implant, which is like a little plasticky type thing that's about like this long, and they put it into my arm. I think it's subdermally or whatever like that, under the skin. I don't think it goes into the muscle. I'm pretty sure it's just under the skin. And they said you can't feel it, and it lasts for 3 years, which would be really, really nice. Because I was thinking about getting the IUDs, either the copper one or the hormonal one, but with this, there's absolutely no estrogen in it, which is really nice. It's all progesterone, or progestin. I don't know how to pronounce it, but it's pure. It's pure progesterone, so there's no estrogen in it, which really helps with mood swings and weight gain and all that kind of stuff. So I'm thinking about that. Let me know if anybody else you guys know has used it before, what they liked, what they didn't like. I think it's kind of a new thing. It's the new one. It's the next generation one. It's not the original. So yeah, let me know.